Good morning, everyone. My name is Jamie, and I'm one of the Health Resources and Services Chair for this cycle. This month's health education topic will be about mask usage during COVID-19 and the wildfire. So to get started, this is probably information everyone is already familiar with, but as a refresher, the ongoing pandemic we are experiencing is due to the viral agent SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome Coronavirus 2, and it causes the disease COVID-19, which has the following symptoms listed here. If you are experiencing any of these symptoms, it is highly recommended for you to reach out to your medical provider and get tested. In terms of COVID-19 transmission, according to the CDC, it occurs when people who are asymptomatically or symptomatically infected are in close contact with other people. It can also spread if individuals have inhaled and or touched a surface with droplets or small particles produced when an infected person coughs, sneezes, sings, talks, or breathes, and then they touch their face. In order to prevent this spread, it's recommended to maintain social distancing, keep objects and surfaces sterile and clean, wash your hands frequently, and refrain from touching your eyes, nose, or mouth, and also wear a mask in public, which is what we're focusing on today. We also just want to acknowledge the fatigue and distress that everyone may be going through due to the shelter in place and staying indoors for a long period of time. We want to acknowledge the gravity of the situation of staying in isolation and how it affects our mental health. So it's imperative that you're taking the steps to take care of your mental and physical health during these times. But we also want to bring attention to the increase in COVID cases here in the US and globally. We want to reinvigorate vigilance and awareness on how to protect ourselves and other people from the virus, especially groups who are susceptible and have comorbidities and underlying conditions that may result in poorer health outcomes. We are encouraging everyone to find the right balance between being cautious and partaking in preventing community spread while also taking care of your mental health, your overall well-being, and autonomy. We hope to share the resources and information we found to help guide you in contributing to protecting yourself and others from COVID. And without further ado, we will be going over mask usage during COVID-19. So part of the importance of masks is being able to prevent the inhalation of the virus and as well as breathing it out to the environment and those around you. A study done in Northeastern University assessed the particle filtration efficacy of multiple fabric masks, as well as surgical, dental, and N95 masks. It was found that N95 had a particle rate filtration of almost 100%. Surgical and charcoal filter masks had around 75% filtration rate, and medical dental mask of around 60% filtration rate. Fabric mask filtration rate ranged around 30 to 70% depending on the type, with Mask J, as you can see on the graph on the right, specifically having a pocket for a filter. But as we all may know, these fabric masks may be loose fitting, so this study sought to improve its efficacy and effectiveness. And by making the fit tighter with a nylon stocking overlay, they were able to observe that there's an increase in particle filtration rate by 15 to 50 percentage points. And during this pandemic, N95 and surgical masks may be in short supply as they are being reserved for healthcare providers and frontline workers. However, fabric and cloth masks provide a great alternative. They are accessible, customizable, and reusable. They could also be made at home, and there are many resources online on how to make/sew them. On your right is an example of how to make a non-sew mask, which literally takes a few seconds to make, which I found really cool. And as the previous mentioned studies showed, having a tighter fit will make a fabric mask almost as effective as the other masks that have been approved, like the N95 and surgical masks. And so to ensure that you're properly wearing fabric mask and maximizing its effectiveness, the CDC recommends choosing masks that have 2 or more layers of washable, breathable fabric, which completely covers your nose and your mouth, and it's snug against your face. And just a few tips to being sterile. Always wash and sanitize your hands before and after putting your mask on. Try as best as you can to tighten loose straps to make it fit snug against your face. Refrain from touching your mask, and if you do so, please wash your hands immediately. If your mask gets wet or dirty, please switch to a clean one and put the used mask in a sealable bag to wash later. Furthermore, please do not wear your mask in any way as shown in these pictures. They do not provide you or others protection against the virus. And if you are having a hard time wearing a mask initially, it's advisable to start slow and start wearing a mask in short intervals until you get used to it. And maybe, you just might need just the right fit. So really browse for the right mask for you. Lastly, if you continue to have concerns with mask usage and have a condition that may make it difficult for you to use a mask, please reach out to your medical provider to make a plan of action to protect yourselves and others during this pandemic. And now Katie is going to be presenting about the wildfires.
Hi, everybody. Okay, I'm going to start with wildfires. So due to climate change, the California wildfire season is now almost year-round, unfortunately, with its peak months in July through October. Wildfires produce a lot of smoke, which is obviously harmful to breathe, especially for those more susceptible, like children, people who are pregnant, elderly people, and people with chronic conditions like asthma, COPD, or heart disease. So it's very important for us to learn ways we can protect ourselves, especially with this COVID-19 pandemic. So if you could go to the next slide, thank you. So now we'll talk about air quality index, also known as AQI. AQI measures how much air pollution there is in your local area, and the lower the better. It can be impacted by things such as construction sites, cars, factories, fires, and other things. So PM, which is also called parts per million, which stands for parts per million, measures the size of the pollution particles. So the smaller, the more harmful, because the pollution can get easier through to your masks and deeper into your lungs. And pollution can lead to issues like trouble breathing, birth defects, or even lung cancer. And the wildfire smoke produces very small particles. And the first step to protect yourself is first learning how to find the AQI in your area. So if you have an iPhone, you could obviously go to the weather app, and then there should be an AQI index portion part. And like if it's red, it's more unhealthy, like as you could see in the photo there. And if it's green, it's better for you. You could also enter your zip code on this website, airnow.gov, and then it should also be able to tell you the AQI. Okay, and now we'll talk about mask wearing and how to protect yourself during these wildfires. So of course, try to limit your exposure to the outside, stay indoors, close all your doors and windows, and if possible, if you have the capacity to have an air purifier, especially one with a HEPA filter, that will really help. But if you do need to go outside, you should wear a N95 mask because they are most effective. As you can see in the photos, these masks look very similar. However, one is an N95 mask, and they always have a logo, so you should watch out for that. Make sure it's actually an N95 mask, because there is one similar, which is on the bottom. That's a dust mask, and it looks similar, but they only protect you from larger particles like sawdust. And according to the EPA, N95 masks and P100 respirators are actually approved by the National Institute of Occupational Safety and Health to be protective against smoke, ash, and the resulting poor air quality due to wildfires. Also, if you're near the wildfires, a lot of people also evacuate or relocate to be safe as well. So next, we just want to reiterate, cloth masks don't protect you from wildfire smoke. Only N95 masks do. And if you can't find any N95 masks, just try to stay inside. And also masks with those one-way valves, like on the bottom photo, though they make it easier for the person wearing it to breathe, they don't protect other people around you from the virus. They are one way, so they protect their wearer, but they don't protect the spread because they only filter out what you breathe, but they don't filter out what you breathe out. So a lot of places have actually banned these masks. And so in total, the solution to accommodate the community against COVID-19 and protect yourself from wildfire smoke is to first monitor the AQI around your area and stay indoors if possible. And if it's normal, refrain from wearing masks with a one-way valve for community protection, and also making sure you're wearing the right mask.